Hi, I'm Dr. Bentley, an internal medicine and gastroenterology specialist. So how can I help you today?
I'm Lisa. I'm 39 years old and work as a graphic designer. For the past several months, I've been having persistent abdominal pain and bloating that's really affecting my quality of life. The bloating is so bad that I look pregnant by the end of the day, and the pain is crampy and unpredictable.
That sounds very uncomfortable and disruptive, Lisa. Chronic abdominal pain and bloating can have many causes. Can you tell me more about the pain? Where exactly do you feel it, and is there any relationship to eating, bowel movements, or your menstrual cycle?
The pain moves around. Sometimes it's in my upper abdomen, sometimes lower, and sometimes it feels like it's everywhere. It's definitely worse after eating, especially larger meals. I've also noticed it seems worse in the week before my period. The bloating is constant but gets more severe throughout the day.
The relationship to eating and menstrual cycle is helpful information. Many women experience worsening digestive symptoms due to hormonal fluctuations. What about your bowel movements? Are they regular, and do they provide any relief from the pain and bloating?
My bowel movements are all over the place. Sometimes I'm constipated for days, then I'll have loose stools. When I do have a bowel movement, especially a more complete one, I do feel some relief from the bloating and pressure. But it comes back pretty quickly.
The alternating constipation and loose stools, along with pain relief after bowel movements and the chronic nature of your symptoms, suggests you might be dealing with irritable bowel syndrome, or IBS. Have you noticed any particular foods that seem to trigger your symptoms?
I think dairy makes it worse, and definitely beans or anything with a lot of fiber. Onions and garlic seem to be triggers too. I've been trying to avoid these foods, but it's hard to pinpoint exactly what bothers me because sometimes I react to foods that seemed fine before.
Those are common IBS trigger foods, particularly ones high in what we call FODMAPs, fermentable carbohydrates that can cause symptoms in sensitive individuals. The unpredictable nature of food reactions is also typical of IBS, as stress and hormones can affect how your gut reacts to the same foods.
I have been under a lot of stress lately with work deadlines and some personal issues. Could stress really be affecting my stomach this much?
Absolutely. The gut-brain connection is very powerful, and stress can significantly worsen IBS symptoms. Stress hormones affect gut motility, increase inflammation, and can alter the gut microbiome. Many of my patients notice their symptoms flare during stressful periods. Given your age and symptom pattern, serious conditions like cancer are unlikely, but it's reasonable to do some basic testing. I'd recommend blood work to check for inflammation and celiac disease, and possibly a pelvic ultrasound to evaluate your ovaries given the menstrual relationship of your symptoms.
What can I do to feel better? This bloating is affecting my self-confidence, and the pain is making it hard to concentrate on my design work.
There are several approaches we can try. Dietary modification is often very effective. The low FODMAP diet has excellent results for many people with IBS. We can also discuss medications for specific symptoms, probiotics, and stress management techniques.
What's involved in the low FODMAP diet?
It involves temporarily eliminating high FODMAP foods like certain fruits, vegetables, grains, and dairy, then systematically reintroducing them to identify your personal triggers. It's best done with guidance from a dietitian experienced with IBS to ensure you maintain adequate nutrition.
Are there medications that can help with the bloating specifically? That's my most bothersome symptom.
Yes, there are several options. Simethicone can help with gas-related bloating, probiotics may help restore gut bacterial balance, and there are prescription medications specifically for IBS that can help with both bloating and bowel irregularity.
How important is stress management for IBS?
It's crucial. Many patients see significant improvement with stress reduction techniques like mindfulness meditation, regular exercise, yoga, or counseling. Even simple breathing exercises during stressful moments can help prevent symptom flares.
Will I always have to deal with this, or can IBS be cured?
IBS is typically a chronic condition, but it's very manageable. Many people learn to control their symptoms so well that they rarely have problems. The key is identifying your personal triggers, foods, stress, hormonal changes, and developing effective management strategies.
I'm hopeful that having a plan will help. I've felt like I was going crazy because the symptoms seemed so random.
You're definitely not going crazy, Lisa. IBS symptoms can seem unpredictable, but there are usually patterns once we start looking for them. With the right combination of dietary changes, stress management, and possibly medications, most people see significant improvement in their quality of life.
Thank you for your advice, Dr. Bentley.
My pleasure. Remember, this information is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for personalized medical care.
Thank you for watching Dr. Bentley's Internal Medicine Doctor Reacts, Life-Saving Medical Cases. If you have any questions for Dr. Bentley, please leave your question in the comment section. Have a great day.